Hi everyone, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon, and today I'm going to talk about lower eyelid blepharoplasty. Lower eyelid blepharoplasty is used for people who have puffiness and bags under their eyes, and I'm going to talk about some technical considerations and why certain techniques are better than others. But before we jump into it, if you don't mind, take a moment to subscribe to the channel. If you like this type of information, I'm going to have lots more of it coming your way. And without further ado, let's discuss. So, lower eyelid blepharoplasty is it's a mouthful of a term describing changes that are made to the lower eyelid. So, what are the changes that the lower eyelid blepharoplasty are designed to treat? Primarily, there's two things that happen to the soft tissue aspect of the lower eyelid. And when I say soft tissue, I'm talking about the distance between the bone of your eyelid all the way up to the lashes. That space is technically your lower eyelid. What changes are happening in that area? Well, depending on your genetics and how you age, you're either going to have some excess skin forming in this area, or you're going to have a combination of excess skin and puffiness that forms. That puffiness is another term for it, just layman's term we use is lower eyelid bags. And what that is it's fat that is pushing forward that normally coats the inside of the eyeball socket, the bony socket where the eye sits in. There's a fat that is in there to insulate and protect the eyeball. And what happens is there's a division that separates the eyelid with the deeper fat component called the septum, the orbital septum. And so what happens with aging is the orbital septum starts to weaken. And think of the orbital septum as a partitioning wall that separates two rooms. If that wall starts to soften up a little bit, you get a bulging of that area and things start to pooch out. That pooching is the bags that we describe. It's not because you have excess fat, it's just that you have fat that is now starting to push against a weakened septum. The component that's related to excess skin, that's something that happens more commonly, and it just falls under the same general category of soft tissue getting longer and more excess as we age. It happens throughout our entire face. The lower eyelid is no exception. So a third component, which is not related to a blepharoplasty, but in my practice always joins a blepharoplasty, is the treatment of the lower eyelid hollowness that we see. And it's incredibly rare to see a lower eyelid that doesn't have hollows under it by the time it has puffiness under it. So for me, I always combine the use of a fat transfer in addition to a lower blepharoplasty. That's a different topic, but for the time being, let's focus on the different types of lower eyelid blepharoplasty and the pros and cons. Before we launch into the details, let's talk very briefly about what are the general outcomes that we want to see after a lower eyelid blepharoplasty. Well, number one, we want to see a lower eyelid that looks completely unoperated. We don't want a change in the appearance of the lower eyelid. We don't want a new shape or a new look. We see a lot of people who have had eyelid surgery and their whole shape of their eye changes, and as a result, a lot of people are afraid of having lower eyelid procedures done. So what we see with that is that if you protect the lower eyelid anatomy, you're not going to see a sagging of the lower eyelid. And what that endpoint really designates is what direction you want to go in surgically. There are certain procedures that make it more high risk for the lower eyelid to sag, a condition called sclerochoe and ectropion, where the eyelid pulls forward. And then there's other techniques, such as the one that I personally favor and do in my practice, called the transconjunctival lower eyelid blepharoplasty. And what that means is that we pull the eyelid down, go from the inside of the eyelid, make a small incision, remove the excessive fat that's pushing on the septum, and then leave that area alone. And why it's important to point out is anatomically there's a muscle that sits directly above the septum, and that muscle is responsible for holding the eyelid in position. So if we don't cut through that muscle, we're not going to see any type of, generally speaking, any type of lower eyelid malposition. Then what happens is, in my technique, I use fat transfer to support the lower eyelid by adding it into the hollow, so that even further gives the lower eyelid support and decreases the risk of eyelid pull down or change in shape. Then what happens is, as I mentioned before, we all almost ubiquitously get excess of skin. So I come onto the outside of the eyelid and I make I remove a little bit of the skin using a technique called the skin pinch. And why it's important to remove the skin from the outside and then come from the inside and remove the fat is because in between those two layers is the or the muscle that we talked about called the orbicularis, which is a circular muscle that goes around the entire eye. And if we don't touch that muscle, if we don't cut through that muscle, we're going to have an eyelid that's protected. So that's in contrast with another type of technique called a subciliary, which just means a underneath the eyelid incision, and then we go through the muscle from the outside all the way down to the fat pad, through the septum, and then we remove it that way. But that puts a lot of strain and tension on the lower eyelid, plus it weakens the muscle, and as a result there's a higher chance of changes to the eyelid shape. And a lot of surgeons, in response to that, will then tack the lower eyelid up to the orbital bone in a technique called a canthopexy, but that changes the eyelid shape even further. So those things for me are not they're not the type of things that we want to include in the procedure, because we ultimately don't want the eyelid shape to change. And that's very important for people. They want a refreshed look, but not a operated look. So as you can see here in these surgical footage, basically what we're doing is we're removing the fat pad through the transconjunctival approach. The little fat pads have 3 different compartments, and we remove each one of them meticulously, making sure not to take too much. And then when we come back out to the outside, we remove a little bit of the excess skin using a skin pinch. And that combination really is, in my opinion, the safest and best way to address the lower eyelid fat and skin excess. So I hope that helped for you to understand a little bit more about how we approach the lower eyelid, the pros and cons of the various techniques, as well as a better understanding of why I choose the particular approach that I do and why I combine that always with the fat transfer. And here are a few before and after examples, so you can kind of appreciate the changes that are happening and how there are no surgical telltale signs, and there's no change of shape, but there's a smoothness and a refreshed look to the lower eyelid region, which is ultimately what everyone, including myself, wants for the outcome. I hope that helped explain a complicated topic and maybe demystify it a little bit. So if you have these particular concerns, you will feel more comfortable proceeding with the procedure. If you like to contact our office, our website information is below. And please don't forget to subscribe and comment, like, and share this video so we can get it out in front of more and more people. Thanks so much for your attention. I hope you enjoyed it. Dr. Karam.